Hi, my name is Gabby Thomas, and my infomercial is on the topic of basic health screenings during an annual physical exam. Oftentimes, when we visit a doctor's office, they need to not only look at our physical health but our internal health as well. Doctors might order a blood and urine test to diagnose and check for further health problems. The most common tests that I have listed on this PowerPoint are a complete metabolic profile, also known as a comprehensive metabolic panel or a CMP12, a complete blood count or CBC, or a urine analysis, also abbreviated as UA. The first test is a complete metabolic profile, or CMP. This test is a combination of testing for 12 chemicals and minerals in the body. I also have those minerals and chemicals listed on the picture on the side. The test reads better natural results if the patient has fasted prior to the exam. This test can diagnose problems such as diabetes, kidney, liver diseases, or hypertension. Now I'm going to teach you how to interpret a CMT test. When looking at the glucose levels, low levels can indicate hypoglycemia, whereas higher levels may point to diabetes, and normal levels are listed at the end of each analysis. When measuring BUN and creatine, which are waste products of the kidneys, high levels can indicate low or poor kidney function. When measuring albumin and total proteins, which are needed to build bone and tissue in the body, low levels may suggest liver and kidney disease or other nutritional problems. Sodium, potassium, carbon dioxide, and chloride are electrolytes in the body used to balance the blood pH. If the blood becomes too acidic or too basic, by these being elevated or lowered, it can cause hypertension, heart failure, kidney and/or liver disease. The next test a doctor might order is a complete blood count or CBC test. This test is a blood test that can detect anemia, infection in the body, and/or leukemia, which is cancer of the blood. This test measures the subcomponents of blood to measure their oxygen, presence of infection, protein and iron levels, as well as the blood's clotting factors. When analyzing a CBC test and looking at the red blood cell count, hemoglobin, and hematocrit, if these levels are below normal, it means you have anemia. And if these levels are elevated, it could point to heart disease. When measuring the white blood cell count, a low white blood cell count can point to an autoimmune disease, bone marrow problems, or cancer. Elevated levels suggest an infection or inflammation of the body. When measuring the blood's platelets, elevated platelets can be extremely dangerous as you are more likely to produce clots in your bloodstream, and if your platelet count is too low, you could lead to hemophilia. The next test a doctor might order is a urine analysis. This is a urine sample test. This test can identify the chemical makeup of your urine, which I have the chemical makeup listed in the picture on the right-hand side, and these tests are often administered to diagnose renal diseases, urinary tract infections, and other urinary diseases. The most common traits to examine in the urine are appearance, proteins, blood, and pH. When looking at the appearance of urine, a darker color can indicate dehydration, and cloudy can indicate a urinary tract infection. When measuring the proteins in the urine, which I have the normal ranges listed at the end of the analysis, an increased amount of protein in the urine can indicate kidney disease, as the kidneys are not filtering the protein out of the urine properly. Blood is measured in appearance as well, so if blood is visibly apparent in the urine, it can suggest a kidney stone or also cancer. When measuring the pH, the normal pH of urine should be basic, which is 7. A high pH can signify diabetes, starvation, kidney stones, gout, or kidney failure, or a urinary tract infection. On this slide, I have my references that I found my information off of, and thank you for watching my presentation, and I hope you have a better understanding on why doctors are performing these tests. Thank you.